Well, good morning. Happy Saturday, everybody. It's Logan here. In terms of those scary movie wrecks, I got them all. I made a little list of them. Thank you so much for those. But man, I just knocked out really super early last night and ended up not watching anything other than The Mandalorian with my wife, and then I knocked right out shortly thereafter. But I do want to make my way through those horror flick recommendations at some point, insofar as they are streaming on Netflix or Hulu or something like that. So in this video, we're going to talk briefly about the election. We're going to talk about stimulus at the end and what we might expect to see in the Senate next week. But mostly, we're going to talk about COVID-19 because obviously the cases are skyrocketing, and also because we have some people on Biden's COVID-19 task force who are not supportive of a national lockdown. Obviously, Dr. Osterholm's statements earlier this week about a 4 to 6 week lockdown got a lot of press, both in national media, local media, as well as making the rounds here on YouTube. But his position is actually not representative of the Biden-Harris COVID-19 task force at this time. I will play you clips later in this video from two other members of the task force, including a co-chair. But let's start with the election just briefly. North Carolina has now been called for Donald Trump. I think we all expected this, not that this is any surprise. And of course, Republican Senator Tom Tillis there has won his re-election bid as well, as we all expected. So obviously at this point, we are looking forward to the Georgia runoffs in January in terms of Senate control. Trump's campaign, as we all know, continues to challenge the election results in several states. Most of these lawsuits have not gotten very far. Georgia will hand recount the votes, as I mentioned earlier this week. The Pennsylvania Secretary of State said yesterday that she will not be ordering an automatic recount because the races in question were not lost by less than 0.5%, which is the threshold for the recount in Pennsylvania. The Trump campaign continues to challenge the validity of about 10,000 mail-in ballots in Pennsylvania that were postmarked on or before Election Day, but received up to 3 days after Election Day. However, even if they are successful in that attempt, and they might be, it will not change the outcome of the election. In other Pennsylvania election news, yesterday a judge denied a Trump campaign challenge regarding envelopes used to send in mail-in ballots in Wayne County, Michigan yesterday. Now, Wayne County is the county where Detroit is. In Wayne County yesterday, a judge rejected a Trump lawsuit to stop the certification of election results in Detroit. There are other such results in other states, but I am not going to go over them at length here. In terms of the House races, Democrats have won 218 seats, which is enough to give them control of the House, and Republicans have won 203 seats. Democrats have so far flipped 3 seats, and Republicans have flipped 10 seats for a net gain of 7 for the Republicans going into 2021. 14 House races remain to be called. In terms of COVID-19, a new record yesterday with 194 new cases in the United States and 1,389 deaths, according to the New York Times. Keep in mind that while deaths lag behind cases by 2 or 3 weeks, also keep in mind that we have a major national holiday coming up here on the 26th, which could amplify the case increases. Please see the CDC guidelines I've linked to in the description below about how to have a healthy and safe Thanksgiving. Now, here are the hotspots. Credit to the New York Times for this map. This is the average daily cases per 100,000 people in the past week, county by county. So you can see a lot of concentration there in kind of the, what would you say, eastern, midwestern states, and also in these kind of more central, southern states, I guess you'd call it. In North Dakota, now looking at this map here, you don't see a lot of red in North Dakota and in several other states, but that's because the population is very sparse in many areas, not very densely populated. But the areas you do see on the map with color are generally red or at least orange. So in North Dakota, Governor Doug Burgum announced several measures late yesterday. These measures include a suspension of high school winter sports until at least December 14th, a new mask mandate, and various limits on indoor dining. In New Mexico, Governor Michelle Grisham issued a stay-at-home shelter-in-place order beginning Monday and lasting 2 weeks. Governor Kate Brown of Oregon yesterday issued orders placing Oregon in a partial lockdown for 2 weeks. I think that lockdowns will continue to be done on a state-by-state basis. I do not believe that the federal government has the power to enact a nationwide lockdown. It can encourage lockdown, it can give guidelines to the states, but I do not believe that it can enforce a nationwide lockdown. I do think that under a Biden administration, we will see a lot more pushing from the federal government on states to take various measures if the virus continues to surge into 2021, which I think we're all expecting it will. But this power is truly at the state level. Now, Much was made earlier this week when one member of the Biden COVID-19 task force, Dr. Michael Osterholm, hinted that he would support a 4 to 6 week lockdown, with the federal government borrowing to subsidize wages and small business losses during that time period. However, and this is getting less press, it seems. However, there are two other voices on Biden's COVID-19 task force who have come out in the past couple days to suggest a more moderated, targeted approach. Dr. Celine Gounder is an infectious disease and global health specialist, as well as a professor at the NYU Grossman School of Medicine. She is a member of the Biden-Harris COVID-19 task force. She was on CNBC yesterday talking about this. Here's the clip.
What should we do right now to try and get the current wave under control, in your view?
Well, it's going to be a while yet before the vaccine is distributed to everyone. So we really do need to rely on many of the same measures for the next several months, which includes masking, social distancing, staying outdoors as much as possible versus indoors when you're around other people, staying away from crowds, getting tested. And finally, if a contact tracer calls you up, please cooperate with them, because what they're trying to do is figure out if you've been exposed, if others have been exposed, how it's spreading in the community, and how we can best contain it. So those measures remain really at the center of the response here.
If we did shut down, like one of your, another person on the council, Dr. Michael Osterholm, for 4 to 6 weeks, I can imagine that would work, I guess, in terms of COVID, but would it be similar to March? Is that being considered? Do you think it's a good idea to do that? What's your feeling?
Yeah, I want to be careful and say that is not the opinion of the Biden-Harris team. As a group, really, the consensus is that we need a more nuanced approach. We've learned a lot since the spring, and we can be much more targeted geographically. We can also be more targeted in terms of what we close. So I think of this as a dimmer switch, not an on and off light switch. So some of those higher risk places are, for example, restaurants, bars, and gyms, whereas schools are not zero risk, but they're much, much lower risk, and they're an essential service, really. And so I think we need to close only those things that really are contributing to the spread, and really try to let as much as possible remain open, like schools, if they're not contributing to the spread.
Dr. Gounder basically said, yeah, what Dr. Osterholm said earlier this week about a 4 to 6 week lockdown is not the Biden-Harris strategy for COVID-19 at this time. She said, we've learned a lot since the spring, and we can be much more targeted geographically as well as in terms of specific industries. She mentioned indoor dining, bars, gyms, right? She said we can keep schools open much longer if we tighten up the areas where we're most likely to see spread. She used the analogy of a dimmer switch rather than a more draconian black and white on-off switch. Dr. Vivek Murthy, who I'm going to show you a clip from next, was the Surgeon General of the United States from the end of 2014 to the beginning of 2017. He was nominated by President Barack Obama. He is the co-chair of Biden's task force, and here's what he had to say on Good Morning America yesterday.
President-elect Biden has predicted a dark winter ahead. How specifically will his coronavirus plan be different than the Trump administration's? And what are you able to do right now before he's inaugurated on January 20th?
Well, thank you so much. It's really great to be with you this morning. We find ourselves at a grim mark in this pandemic. We're seeing cases skyrocket, over 168,000 cases yesterday, which is the most we've ever seen. We're seeing hospitals fill up. We're seeing the death toll continue to rise. And what's really important here, I think, is just to recognize what the cost of this pandemic is, because it is the lives that are lost, but it's also the many people who are struggling with lingering symptoms, those who've been hospitalized. It's jobs loss and economic pain. It's kids who can't go to school, and it's people who are not able to go home for Thanksgiving. This is a difficult moment. But I also want to point out that the mental health impact of this pandemic has been profound too, that more people are experiencing anxiety and depression and loneliness, and this is really taking a toll. So we find ourselves at a point where many people recognize things are bad, but they're fatigued. And part of what President-elect Biden has spoken about is the need for us to really lead this response with science, to communicate clearly with people about where we are, including when things aren't going well, and to really be precise in how we deliver the kind of interventions that are needed.
But
I'll give you an example of this. In the
Doctor,
spring,
forgive me, specifically, what is Biden's plan? How is it different than what we're seeing from the Trump administration?
Well, here's what you'll see with President-elect Biden's plan. There's going to be a focus on, number one, stopping the spread, on ensuring that we can reopen safely, and on also making sure that we are focusing on the hardest hit populations. Now, how do you do that? Well, number one, you focus on expanding testing capacity. We have struggled still to this point, even though we've made some progress in the last 8 months. We still don't have adequate testing so that anyone who wants a test can get one and get results quickly. We still don't have enough testing to be able to do surveillance testing in universities, in workplaces, and in other places that are higher risk, like prisons and nursing homes. So that is an area where you'll see President-elect Biden really focus on expanding capacity.
Doctor,
but you'll also see him utilize.
Forgive me, I need to move on again to another question here. One of the other members of your advisory board, Dr. Michael Osterholm, floated the idea of a 4 to 6 week lockdown to get the spread of the virus under control. Is this the view of the incoming Biden administration? Should Americans anticipate more lockdowns?
Well, I don't think this is a lockdown or not locking down. I think that's how we thought about this in this spring. But I think we've learned a lot since then about how this virus spreads and what we can do to reduce risk. And right now, the way we should be thinking about this is more like a series of restrictions that we dial up or down depending on how bad spread is taking place in a specific region. In New York City, for example, what you're seeing is them target their interventions down to the zip code. So we're not in a place where we're saying, shut the whole country down. We got to be more targeted. If we don't do that, what you're going to find is that people will become even more fatigued. Schools won't be open to children, and the economy will be hit harder. So we've got to follow science, but we've got to also be more precise than we were in the spring.
Dr. Murthy, thank you so much for your time this morning. We appreciate it.
So Dr. Murthy acknowledged the reality of the increase in COVID-19 cases, but said that we're not in a place where we're saying to shut the whole country down. He brought up the issues that come with lockdown, such as depression and loneliness. He highlighted testing, of course, and when asked about Dr. Osterholm's mention of a 4 to 6 week lockdown, Dr. Murthy said we have to be more targeted in our approach, a series of restrictions that we dial up or dial down. That's kind of a similar analogy, similar language to Dr. Gounder, where she was talking about a dimmer switch rather than an on-off switch. If we don't do that, if we aren't targeted here and we just want to shut the whole thing down, Dr. Murthy said that people will become even more fatigued and the economy will be hit harder. He said, let's follow the science, but let's be more precise than we were in the spring. Now, I'm personally not a doctor, but as I've said before on the channel, I do agree that lockdowns should be determined on a local level, a targeted level, in certain geographic areas, not some all-or-nothing lockdown mandated from on high by the federal government. President Donald Trump addressed the nation from the Rose Garden yesterday. These were his first public comments in a week. He took no questions. The talk was mostly about Operation Warp Speed, which is the White House's vaccine efforts. Trump actually kind of hinted that he might be coming to terms with the Biden administration in 2021. Here's the clip.
According to some estimates, a national lockdown costs $50 billion a day and hundreds of thousands of jobs every single day. Ideally, we won't go to a lockdown. I will not go. This administration will not be going to a lockdown. Hopefully, the whatever happens in the future, who knows which administration it will be. I guess time will tell. But I can tell you this administration will not go to a lockdown.
So Trump said this administration, his administration, will not go into a lockdown. He said, who knows which administration it will be? Time will tell. So there you have it. According to Donald Trump, time will tell. He kind of left the door open to the possibility of a Biden administration in his mind. Trump also criticized New York Governor Andrew Cuomo, saying that the governor does not trust the White House, so the White House won't be delivering the Pfizer vaccine to New York until it has authorization to do so. This is likely in response to Cuomo saying that the state intended to conduct its own review of the Pfizer vaccine's approval by the federal government. Now, before Trump spoke, Joe Biden issued a statement criticizing the president for not addressing the skyrocketing COVID-19 cases really at all. Biden said that Biden will not be president until next year. Then the crisis does not respect dates on the calendar. It is accelerating right now. He said that urgent action is needed today, right now, by the Trump administration, starting with an acknowledgement of how serious the current situation is. In terms of stimulus, Republican Senator Marco Rubio tweeted out a video yesterday basically saying the same thing he's been saying for a long time, which is that we need another round of PPP. As he said for a while now, he thinks that if Democrats and Republicans can't agree on a big stimulus package, let's at least do a standalone PPP bill. This is basically déjà vu, folks. They tried this 3.5 weeks ago. Remember, what was it? I think it was the third week of October there. McConnell put up 2 bills on the Senate floor that week. On the Tuesday, I think it was, he put up a standalone PPP bill that would have provided about $258 billion in new funding for the PPP program for a second round to the hardest hit small businesses. That failed in the Senate 57-40, obviously didn't hit the 60 votes required for cloture, but the promising thing was that 5 Democrats actually voted in favor of it. If this bill or something similar is put up to the Senate again this coming week, will more Dems vote on it to get to the 60 vote threshold? But then, of course, it would go to the House, even if successful in the Senate, and I don't think that Pelosi would want anything to do with it. Some Dems would. Lots of moderate Dems who are very vocal about doing whatever we can right now to help the country in some way, but it's doubtful, of course, that enough Dems would go for it, including Nancy Pelosi. We might even see McConnell put another skinny bill on the floor this coming week, and that would be super déjà vu, because going back to the third week of October, during that week, not only did McConnell put up a PPP bill, like Rubio was talking about, but also a skinny bill, and obviously neither one of those advanced to a final vote, because you need 60 votes to advance to a final vote. You need enough Dems on board. All right, everybody, that is my update for this fine Saturday morning, November 14th. Thank you so much for watching. I hope all of you have a wonderful Saturday, a wonderful weekend, and I will see you in the next video. Bye-bye.